Treatment protocol D. Patient scanning. To make the complete patient scanning, the therapist must place the negative pole of a magnet in each of the scanning points to see if they have a pH imbalance. But this is just for scanning purposes and not necessarily to determine the final polarity that will be needed in the altered point. It is very important to clarify that when we say that we should put the negative polarity of the magnet, or simply the negative magnet at a certain point, we mean that the negative polarity should be pointing and touching the patient's body or clothing, and not vice versa. In other words, the therapist should see with his own eyes the opposite polarity, that is, the positive pole. Following the technique we discussed above, the therapist checks all scanning points one by one with the patient lying face up. It is desirable that the therapist has an assistant that will put the magnet at each point while the therapist is saying its name aloud. Or instead, the assistant can say the name aloud and put the magnet in that point while the therapist only checks and compares the patient's feet. If the therapist cannot have an assistant, the patient himself can place the magnet at the point where the therapist tells him. Thus, the therapist can devote his vision only to check the length of the legs. The exact placement of the magnet need not necessarily be as precise and specific as acupuncture points, for example. The reason is because magnets have a magnetic field that allows them to act from a distance. If the patient's right leg shows no change in length over the left leg when a magnet is placed at a scanning point, that means that this point is perfectly balanced. Then the therapist can move on to the next scanning point of the list, and he will check the next point exactly the same way. This will repeat it with all items on the list. As soon as the therapist arrives at a scanning point that causes a shortening or lengthening of the right leg, this means that the pH at that point is unbalanced. Variations in length may vary from a few millimeters to a few centimeters. It is important that the therapist then acts as follows. If the right leg is shorter, then that point is alkaline, and the therapist must leave the negative polarity of the magnet at that point in the exact place where the shortening of the leg is greater. This is because, according to the law of charges, two like charges repel. This reminds in some way the homeopathic principle that like cures like. We recommend that the therapist or his assistant fasten the magnet at that point with masking tape. If the right leg elongates, then that point will be acid. In that case, he must flip the magnet to change its polarity, and put the positive polarity at that same point, in the exact place where the elongation of the leg is greater. We also recommend that the magnet is fastened to that point with masking tape, because it is important that the magnet does not move once the exact altered point has been found. If the magnet is not firmly fastened with masking tape, any involuntary movement of the patient, slippery clothing, the attraction between magnets, coughing, or even the patient's breathing can move the magnet, and then it would no longer perform its function properly. Now we have our patient with the right leg shorter or longer than the left. But the pH is not yet rebalancing, and therefore no remedial action is taking place yet. For this to occur, the therapist has to find another scanning point which forms a biomagnetic pair with the first point already found. In other words, the altered biomagnetic pair needs to be found. If the therapist placed a negative polarity at the first point, then he should find another point where, if he puts the positive pole of another magnet, both legs will match again in length. When he finds that point, he will leave there that second magnet and fasten it also with masking tape. But if the therapist placed a positive polarity at the first point, then he should find another point where, if he puts the negative pole of another magnet, both legs will match again in length. This second point that manages to match both legs will certainly be one of the scanning points that may resonate and form a biomagnetic pair with the first point found. Therefore, the therapist needs to learn well the whole list of biomagnetic pairs that are currently known in order to know well and by heart all the scanning points, and to be very clear about what points can resonate with what other points. But let's not forget that this science is still young and new pairs are getting constantly discovered. When the therapist discovers the second pole of the altered pair and checks that both legs match again by putting the opposite polarity of the magnet, then the pH in these 2 points will rebalance. The negative magnet placed in the alkaline point of the biomagnetic pair will repel the OH- ions, and the positive magnet placed in the acid point will repel the H+ ions. Then the 2 opposing charges will be pushed internally against each other until they cancel out. The pH of those 2 points will thus become neutral, and only then the remedial action will take place. Discovering exactly what point is resonating with the first point found is sometimes not easy. Some points, such as the kidney or the liver, can resonate and form biomagnetic pairs with many other points, and the therapist must check them all one by one until he finds the point with which both legs match in length. For only when both legs are equal is the pH rebalancing. Summarizing the main idea that the therapist must follow, the most important thing is to put the negative polarity of the magnet at the point which causes the right leg to shorten, and put a positive polarity at the point which causes the matching of both legs, or else to put the positive polarity at the point which causes the right leg to elongate, and then put a negative polarity at the point which causes the matching of both legs. It must be noted that the important thing is not to diagnose that the patient has a pathogen or another, one pair on another. The important thing is to match his two legs in order to rebalance that pair and all other altered pairs that the patient may have. This way, his body will not have any internal pH imbalance and therefore will not have any biological terrain that allows the development of diseases. We re-emphasize that the biomagnetic pair technique is very effective when all altered pairs that the patient may have are properly rebalanced. But it is not as effective when the therapist puts magnets according to the symptoms of the patient. Matching the two legs with a couple of magnets and rebalancing the pH is what permits the body to heal. But placing magnets on points that are not altered is generally useless. It is not harmful, but it does not help either. When the therapist has any hesitation to find the second pole of a biomagnetic pair, he must always follow the principle. If the two legs match when placing the polarity of the second magnet at that point, then he is acting correctly. But if the two legs are not equal, then the polarity is not correctly applied, or the altered biomagnetic pair has not been found yet. In that case, the therapist should still keep looking for it.